What other neurological disorders do you treat here?
So we treat a lot of patients who have Parkinson's disease, and I specifically am certified to treat these patients, and I really enjoy working with them. Parkinson's disease is a very common neurological condition. It affects 7 to 10 million people worldwide, and 60,000 new diagnoses are made each year in America. So that's a lot of people that are suffering from this disease.
How can physical therapy help a person living with Parkinson's?
So there have been multiple research studies that have shown that exercise performed at a high enough intensity can really help to minimize the symptoms of Parkinson's disease, and in some cases even reverse some of the symptoms. So it's, our job as physical therapists to direct the patient to the appropriate kind of exercise that they can perform in order to decrease their symptoms. And another really important benefit of exercise is that it's been shown that patients who do a lot of exercise have to take less medication. So a lot of the Parkinson's disease medications have unwanted side effects, and so the less medication that the people can take, the better off they are.
Kelsey, in treating Parkinson's disease, what sets Wendy Webb Schoenwald Physical Therapy apart from other centers that may also treat people living with Parkinson's?
So I am certified in treating patients with the LSVT BIG program, which is an exercise program that's evidence-based and focused on intensive large amplitude movements. So the patient will come 4 days a week for an hour of one-on-one time for 4 weeks to complete the program. So there may be some patients or people who may not feel that they're able to tolerate that. So we can also offer, therapy 2 or 3 times a week where we would incorporate some of the large amplitude movements and also focus on balance and some other things if patients aren't able to tolerate the full program. And then another part that's really important about our clinic is that we have an exercise physiologist named Hannah, and she has been certified in the Power for Life program, which is a kind of a branch off of the LSVT BIG program. And Hannah is able to see these patients after their discharge from physical therapy to kind of maintain the progress that they've made. So that's a really important part of Parkinson's disease because it's such a chronic, lifelong condition. People really need to keep up their exercise in order to keep seeing the benefits. So Hannah can see the patients one-on-one, and I'm typically there when she's seeing them, so the two of us can communicate. And if we feel as if the patient maybe needs to come back to physical therapy for a little bit, if they notice their balance is changing or some of their symptoms are changing, then it's very easy to get them back to see me because I've kind of been able to keep a tab on them as they've been going along. And Hannah also has a class that she runs based on the Power program that's 2 days a week. So after people have, gone through some physical therapy, if I feel they're appropriate for the class, she sees them and they have a really great support system going on, and they really kind of bounce ideas off of each other. So it's a really nice way to kind of have a community support for them and have them continue exercising after physical therapy.
Thank you so much for taking time out.
Thank you
your
for
busy
having
schedule
me
today.
Thank you. What Michelle's doing is part of the LSVT BIG program, so we're really focusing on large amplitude movements. And I'm asking her to speak out loud, and she's speaking softly now because I'm talking, but I really try to get people to speak as loudly as they can because voice volume is also something that's affected with Parkinson's disease, so we're trying to increase the amplitude of her movements, the amplitude of her voice. And she's really supposed to be working hard. I want her to be working at least a 7 or 8 out of 10 effort with each of these exercises. Twisting component is really important because rotation is something that's lost a lot in patients with Parkinson's. So we're really trying to work on getting her to rotate all the way around with this one. She's doing a good job.